Welcome, medical students, to today's lecture on surgical site infections. In this comprehensive session, we will delve into various aspects of surgical site infections, including their assessment, epidemiology, pathogenesis, prevention, and management. By the end of this lecture, you will have an in-depth understanding of the complexities surrounding surgical site infections and the strategies employed to prevent and manage them. Understanding wound classifications is crucial for healthcare professionals involved in wound care and surgery, as it helps assess the risk of surgical site infections. Clean, contaminated, and dirty infected wounds all carry different levels of risk based on various factors. Surgical site infections have a significant impact on global healthcare systems. Understanding the epidemiology of these infections is essential for healthcare professionals to develop effective preventive and management strategies. Epidemiological data help identify risk factors, high-risk populations, geographic variations, and trends in SSIs. Factors such as age, underlying diseases, surgical technique, and hospital environment contribute to variations observed in surgical site infection rates across different regions. In the video, we will explore how surgical site infections occur and persist. It involves the interaction between the patient's defenses, bacteria, and biofilms. Bacteria can attach to surfaces and form protective biofilms, making them resilient against the immune system and medications. Understanding these processes is crucial in developing ways to prevent and treat infections. Assessing the risk of surgical site infections is crucial for implementing appropriate preventive measures. A comprehensive review of risk assessment tools enables healthcare professionals to identify patients with an increased likelihood of developing SSIs. These tools incorporate patient-related factors, surgical procedure characteristics, and preoperative optimization strategies. By accurately assessing the risk, healthcare professionals can tailor interventions such as antibiotic prophylaxis, wound care, and surveillance to mitigate the risk of surgical site infections effectively. Antibiotic prophylaxis is crucial for preventing surgical site infections. However, determining the best timing and duration of administration remains a topic of debate. Factors such as surgery type, patient risk, resistance patterns, and antibiotic characteristics must be considered for optimal prevention. Surveillance and reporting systems are essential components of infection prevention and control programs. These systems help identify trends, monitor surgical site infection rates, and assess the impact of preventive measures. Implementing effective surveillance and reporting strategies involves gathering accurate and timely data, utilizing standardized definitions, and incorporating feedback mechanisms to healthcare providers. This information enables targeted interventions, quality improvement initiatives, and benchmarking practices to enhance patient safety and minimize surgical site infections. Prevention bundles provide a systematic approach to reducing surgical site infections by incorporating evidence-based practices and interventions. These bundles typically include multiple components such as preoperative optimization, proper hair removal techniques, skin antisepsis, antibiotic prophylaxis, sterile surgical technique, appropriate wound closure, and postoperative wound care. Implementing these bundles as a comprehensive package rather than individual interventions has shown significant reductions in surgical site infection rates and improved patient outcomes. Accurate microbial identification and susceptibility testing are crucial for targeted antimicrobial therapy in surgical site infections. Understanding the microbiology of SSIs allows healthcare professionals to select appropriate antimicrobial agents, considering local resistance patterns and the patient's individual characteristics. Techniques such as conventional culture methods, molecular assays, and rapid diagnostic tests aid in the timely identification of pathogens and guide the selection of empirical and definitive therapy. Continued research efforts focus on developing emerging strategies to prevent surgical site infections. These strategies range from the use of antiseptic sutures, wound dressings, and implants to the development of novel immunizations targeting specific pathogens. Incorporating these innovative approaches into clinical practice holds great potential for further reducing the incidence of surgical site infections and their associated morbidity and mortality. Timely detection of surgical site infections is crucial for implementing appropriate management strategies. Advanced diagnostic tools, such as molecular assays, biomarkers, and imaging techniques, have revolutionized the diagnosis of SSIs. These tools enable rapid and accurate identification of pathogens and aid in distinguishing between superficial and deep infections, allowing healthcare professionals to tailor interventions promptly. Managing deep surgical site infections requires a multidisciplinary approach involving surgeons, infectious disease specialists, and wound care experts. Treatment strategies often involve a combination of surgical debridement, antimicrobial therapy, and adjunctive measures such as negative pressure wound therapy and hyperbaric oxygen therapy. Recognition of specific factors influencing treatment outcomes, including microbial virulence, antimicrobial resistance, and patient-related factors, guides clinicians in formulating optimal management plans. The emergence of multi-drug-resistant organisms poses a significant challenge in the management of surgical site infections. Implementing effective containment and prevention strategies is imperative to prevent the spread of these resistant pathogens and to minimize their impact on patient outcomes. Strategies include appropriate antimicrobial stewardship, infection control measures, and interventions aimed at reducing surgical site infection rates through improvement in surgical techniques and perioperative care. In conclusion, surgeons and healthcare professionals must fully grasp the complexities of surgical site infections to provide optimal patient care. A comprehensive understanding of wound classifications, epidemiology, pathogenesis, prevention strategies, diagnostic tools, and management approaches is crucial in combating this burden. Ongoing research and advancements in prevention and treatment promise to further reduce the incidence and complications of surgical site infections.